Hi, and welcome back to another Waterbury Hospital podcast. I'm your host, Jeremy Rodorigo. Joining me today is our manager of social work who works in our case management department, Erika Sacchi. Erika, thank you.
Thank you for having me.
The conversation we're going to have today is important because there's a lot of misunderstanding, or people just don't know about what we call advance directives, right? And so what is an advance directive, and why is it important for patients and their loved ones to understand what advance directives are and what they mean?
So advance directive really is the generalized term in regards to a patient's wishes. So there are different kinds of advance directives. There's in regards to their medical, which is in regards to their person, as well as in regards to their estate, so their financial. And patients have these advance directives designed so that they are able to voice what they want done with their person as well as with their finances if they are not able to make decisions for themselves. So like I said, advance directives really is just a generalized term. It can address if a patient, what they want done if their heart stops, if they want a provider to push on their chest and try to restart their heart, if they're not breathing on their own, if they want a provider to put a tube down their throat to help them breathe. It also addresses things like types of nutrition, if a patient's not able to eat on their own, if they want an alternative means of nutrition, so a doctor putting a tube in their nose to put feedings into their stomach, or a permanent feeding tube which would go into their abdomen, that would go directly into their intestines. So a patient, when they are of sound mind, we always encourage patients to have these conversations so that they are able to adequately voice what they want done to their body.
And so this is important because nobody wants to go to the hospital, and there are times when people go to the hospital and it's completely unexpected. And you have families and patients trying to make decisions kind of on the fly about what would be best for mom or dad or Uncle Joe or whoever. And it's not really they're under duress, right? They're trying to make decisions, and this is something they hadn't thought about. So, what are the steps that people need to take, maybe as a loved one gets older, or a family member or a spouse gets older, or they develop a chronic disease that is going to eventually become progressively worse, and it's likely they're going to have a stay in the hospital. What should people do to prepare for that?
I always encourage patients and their family members to have this conversation as early on in their lives as possible. Right. Even a 20-year-old or a 30-year-old should be having this type of conversation with their family member so that the person that will be making decisions for them understands exactly what their wishes are. Just like you said, family members are under duress when they come into the hospital. Right. There's a lot going on very quickly sometimes for patients. And so knowing what a patient wants long before they come into the hospital really makes that decision a lot, not necessarily easier for a family member, but they understand that this is what my mom wanted. This is what my sister wanted. And they have it very clearly written out that this is what she would have wanted for herself if she were able to make these decisions.
And so what does that documentation look like in terms of from your perspective? So what sometimes folks don't understand is when someone comes into a hospital, they're taken care of by doctors and nurses and PCAs, but they're also being followed by social workers and case managers.
Yeah, so every patient that comes into the hospital will be asked if they have an advance directive. If they are admitted into the hospital, they will be asked. And based on the answer to that question, will trigger a social work consult. So if they do have an advance directive, it will trigger the social worker to go meet with the family and try to obtain a copy of that advance directive. We do recommend that every single time your family member comes into the hospital, if they have an advance directive, to bring it with them.
Right.
Things change. If we have an advance directive from 2 months ago and this patient has changed their advance directive, we should not be acting on that old advance directive. We should be acting on the new one. So we always encourage family members to bring in that advance directive for every hospitalization.
And what are the differences you mentioned about different powers of attorney, right? We hear that phrase a lot. I have power of attorney over mom's affairs, or I have power of attorney over dad's affairs. What does that mean, and what are the differences in powers of attorney?
So there's different things. We have powers of attorney, we have healthcare proxies, we have living wills. All of them generally mean the same thing. They just have kind of slight variations.
Yeah.
The most important thing to remember with all of these documents is one of the main lines in that document says, if I am unable to make decisions for myself. So this document is not enacted until this person is not able to make decisions for themselves. There are financial pieces to it. There are medical pieces to it. Depending on what type of coverage you want in regards to decision makers, that would determine what type of document that you would select for yourself or your family member. It would have to be notarized, and you would have to have 2 witnesses, typically for all of those types of documents. We always encourage patients to either seek an attorney's assistance because that would give them the best ability to figure out specifically the financial piece of it. We always encourage patients to have these conversations with their medical providers in regards to the medical aspect of their decisions, whether that's in the hospital or within the community. It's a conversation that should happen over time. I don't think it should be a very quick decision that someone makes. Like we said in the beginning, it's a difficult conversation to have. It's very difficult to hear a family member, especially if they are nearing towards the end of their life, saying, I don't want to have my chest pushed on. I don't want to have someone breathe for me if I can't do it for myself. It's a very difficult conversation to process because a lot of us understand what that means. That if my family member becomes so sick that their heart stops, there's nothing that the provider can do because my family member has elected to not have their chest pushed on.
And I would imagine that could be difficult in the moment, especially if all of the family members aren't on the same page about this. They haven't been consulted, they weren't brought into the loop, and so some of them know that this is what, mom would have wanted, some of them don't know, and it could cause a little bit of family anxiety and some difficulties with the family, and I think you guys have to get brought into that.
Absolutely.
So how do you navigate those types of situations?
We always bring a family together. We always have a copy of that advance directive to say this is what your family member wanted. Unfortunately, family members, if they are legally the next of kin, are able to act against what the person wishes. But within the hospital system, we always encourage the family members to act how they wanted their person to receive treatment. So, for example, if we have a son that has power of attorney over his mother, she is not able to make decisions for herself, and now we have multiple family members coming in saying, save her life, do everything. We would ethically have a conversation with family and say, but that's not what your mother wanted. We would try everything in our power to try to follow the wishes of the patient, because when that patient was alert and oriented, she made these decisions for herself. So we always try to get together as a team. A lot of things can be worked out just by talking. I always say communication solves 90% of issues, and I live by that for the majority of aspects of my life, work, home. It really does solve a lot of things. So really just having that open and honest conversation with your nearest family members, your doctor, and just really getting it out in the open that this is what I want. This is what I'm choosing for myself.
And so not everyone heeds this advice, right? Not everyone gets these documents in order, has these conversations. What happens when somebody becomes, mortally ill, critically injured or whatever, and now these conversations have to happen, and we never discuss this with Uncle Joe, right? We never discuss this with Dad. And what legal rights does the family have for the decisions that are going to be made for the loved one?
So legally we have to go, if they don't have an advance directive, we have to go through the next of kin rule, which states that if someone is married, their spouse would make decisions for them. If they have children, their children would then make decisions for them. And it goes down the line. Each state has it a little differently, but it would go down the line. So spouse, children, parents, and then I think it goes aunts and uncles, cousin, it just goes down the line. And ultimately, we have to go down that line. And if they have 3 siblings and we have to go through the first sibling, say, do you want to make these decisions for your family member? If they say no, we go to the next one. And we make our way down that line until we get to the end of the family line. We pray that someone would choose to make decisions for their family member. Right. Unfortunately, there's also patients that don't have any family, that physically do not have any living relatives. And when it comes to that point, we will do our due diligence as a hospital and as social workers to try everything in our power to find a living relative for this person. Sometimes there isn't anyone. And so that next process would be called a conservatorship, whereas the hospital would petition the probate court to legally have a judge say, I am appointing X person to be this person's decision maker. Typically, they are attorneys. They could be people out in the community that sign up to be conservators. And so now this person would have someone to make decisions for them. Right. But just like you said, they also don't know this person. They don't know anything about this person. They were just appointed, and they have to act in the best way for this patient that they can. If they understand that this patient does not have any ability to regain any sort of function, we could always look at changing a code status then.
Right. And a code status is resuscitate or not resuscitate.
Yep.
Yeah. And these can be, we already talked that these can be difficult conversations to have, but that's kind of part of your job is, because you're not only caring for the patient, but you're actually caring for the family too.
Correct.
Right, because the patient is, in whatever medical condition they're in, alert, oriented, or not. Well, probably not, right? Or they would be making their own decisions. But now you move your focus over to the family and just give them all the information that you need, right? Communicate with them. This is the expectation. This is what the doctors are saying about the condition. This is what we think the prognosis of your loved one is. And you're really working now with the family, right? Your social work skills are really becoming engaged, right? Because this is not an easy thing sometimes, right? I would imagine there's people who are just not willing to accept that, mom or dad or whoever is nearing end of life, and they have to. Now you're putting that on them, and you're saying, listen, we really want to just. I don't know how you do that, how you engage.
We just part of being a social worker is really learning to, I call it gain rapport with that family member. So even just having a conversation about nothing and just gaining rapport with that family member so you're able to have that deep, honest conversation with them. Sometimes that gaining rapport may take a couple days. Just checking in with them, seeing how they're doing, how their day is going, and just having those little conversations so that this person now becomes comfortable with me and I am able to have that deep conversation. If a random person walked up to me and was like, hey, let's talk about your mom's code status. Right. She's dying right now and we need to talk about this. That is a lot harder of a conversation to have than when I have gained trust in this person. I've talked to you multiple times a day for multiple days in a row. So now I have that trust in you to be able to have this conversation. And they trust me as a professional and even as a person to be able to have that really, really difficult conversation.
And this is what I think is important about all the caregivers in this hospital is we always think about doctors and nurses and things like that, but we don't think about all of the other people who are involved with care. And we don't just treat the patient, we treat their families, and we treat the community. We're a community hospital. And that's why the work that you do is so important. And this topic has been brought up over and over again about advanced directives and living wills and powers of attorney and all the things that people don't quite understand what they are and why they are. And that's why I think it's important that you came on today. I appreciate the work that you do. I
you.
see you working very hard every single day in the hospital. I hear you because you're very loud in the halls.
Many people have said that.
But we appreciate what you do. Seriously, it is amazing the work and the amount of stress. I can imagine at the end of the day, you're full, right?
Yes,
You're
absolutely.
full.
But it's a very, very fulfilling job.
Right. It's very rewarding, right?
It really is.
Right.
It is.
And I can see that because you have an amazing team of people who work in case management and social work. They're
I
just
agree.
absolutely amazing.
We do have a pretty great bunch.
Erika,
I would have to agree.
I thank you for joining me on the podcast today. I think it's valuable information. Please heed the advice that Erika has imparted on you today. Have those conversations with your family members way before the need. And hopefully there may never be a need, but as long as you have those conversations, we don't have all the anxiety that might come along with not having those conversations in advance. So thank you for joining me. Thank you again, Erika.
Thank you for having me.
Appreciate it. We'll catch you next time.